400,000 people die in Kenya every year due to various illnesses and accidents. Lack of critical care is a major cause of death. Many victims of that situation, including the late Alex Madaga, whose 18-hour wait for an ICU facility grabbed headlines, would have been saved if only ICU facilities were readily available across the country.
Kunafaa at least kila county iwe na ICU tusaidie maisha. I lost my cousin, it was 2012 kwa sababu ya kukosa nafasi kwa ICU. Na hii shida yenye imefikia, nimepoteza mume wangu, singetaka tena Mkenya mwingine na haja akahangaika kwa sababu hati hakuna nafasi ya ICU nini na nini.
The acute emergency room at the Kenyatta Hospital is a transit point for patients awaiting ICU treatment. It's always full, day and night, just like the ICU itself.
Almost every day, every minute, unless a patient is being discharged or unfortunately we have lost, these beds are full. And that is the purpose of the referral office, that they'll be able to coordinate when a hospital or any health facility calls and says they have a patient, a sick patient who needs ICU services, then they'll be able to be told we have a bed and they bring the patient. If they don't call, then that means that they'll arrive here when it's full. And of course, every patient is very important. And there is no way we are going to disconnect one patient to put another patient, because every life is important.
That Kenya's public hospitals are in dire need of more critical care units is not in doubt. Kenyatta National Hospital, with a bed capacity of 2,000, should have at least 63 ICU beds and a further 125 high dependency units. What there is right now is 36 ICU beds, 5 of them reserved for children, and the high dependency unit is currently non-existent.
Effectively, we had 3 hospitals, public hospitals, with good ICU, functional ICU, not ICU by name, functional. So it was Kenyatta Hospital, Moi Referral Hospital, and then Coast Provincial Hospital. So we can imagine a journey along Mombasa Road. The ICUs were at both ends. It's over 500 kilometers. So should anything happen to you around Voi, Mutitwandei, by the time you reach Nairobi, you're gone. That is why you hear 3,000 Kenyans die on our roads. We can save half of them if we had ICUs positioned in strategic areas.
To address this situation, all former provincial hospitals in Nakuru, Eldoret, Garissa, Nyeri, Embu, Kakamega and Mombasa have now been equipped with ICU facilities besides Machakos, Thika and Kisii hospitals, which are now in various stages of development. In all, 900 ICU units will be available in public hospitals across the country by March next year.
It's available for you for free. You enter an ICU, you don't need a deposit as a requirement.
Yes.
Most private hospitals will tell you put between 200,000 and $1 million shillings deposit.
9 p.m. at Machakos Level 5 Referral Hospital, and the screams of a toddler in the ICU breaks the silence. But rather than depress his mother, the screams of 4-year-old Mark Ngovu bring joy.
Lava should be going home when they start screaming.
It's a good sign. Eh?
Yes.
Another 3-year-old recovers on the adjacent bed as Ngovu prepares for discharge. They are among the first beneficiaries of Kenya's newest ICU facility, with a bed capacity of 6 and an ICU bed for newborns.
We are happy that in these rural areas we are able to have a neonatal ICU. Currently they are only available in Kenyatta and Gertrude's Hospital. We lose a lot of newborns because they don't have a place to take care of them. Currently, 40% of our under 5 mortality. So children died before 5th birthday. 40% of those deaths occur within the first month of birth.
The Ministry of Health has launched a referral strategy in a bid to streamline patient movement from the community level 1 facilities, which are meant to handle simple ailments, to the highly specialized care available only at the country's biggest referral facility, Kenyatta National Hospital.
But as you see right now, the challenge with us in Kenyatta is that we are actually handling cases from level 1 all the way to level 6.
But what's in an ICU facility?
This is a ventilator which ventilates the patient or gives oxygen to the patient when the patient cannot breathe. Cardiac monitor to monitor the patient, the parameters, mostly we see the vital signs. Then also on the wall we need oxygen point. It's piped from the plant to the ICU. Yeah, that is very important because the cylinders, sometimes the oxygen gets off, you have to fix another nini. But the plant is continuous. Now you are sure that your supply of oxygen is throughout.
This is a special mattress that has bubbles, so it keeps moving. Keep moving like that. Now it's full like this. If you touch here, you can touch this side.
Oh, it's not just a mattress.
Yeah, it's not a mattress. If you touch here, it's more.
Oh,
then
there's more here?
Yeah, yeah. Look at the pressure here. It's different from the pressure there.
Wow.
Yeah, yeah. So it keeps changing. It's electrical mattress. It really aids in recovery.
Oh.
Yeah. In most ICU, without this, you recover, but then you have bed sores. Then you start another surgical process of treatment.
An ICU is also not complete without an anesthetist, a physiotherapist, an occupational therapist, a nutritionist, and a critical care nurse. The World Health Organization stipulates that the ratio of nurse to patient in an ICU should be 1:1. Sylvie Tibet, Citizen Weekend.